Thank you very much. Good morning, everyone, and welcome to another session. I'm going to start with a usual presentation and then take questions. I just want to note that it's been very difficult for me to catch up on all the pre-questions that have been sent to me. So I've got a lot of questions that come to me before, and I really don't have time to address them all. So please feel free to ask me any question you want during these media briefings. I'll stay on as long as is necessary moving forward. So let's begin. I'm going to show you latest sort of statistics and where we are in terms of some of our challenges and some of the things that we're trying to. First of all, as you know, because of the changes in reporting and testing, we have changed the way our dashboard is going to look. Right now, we don't have it up. We're going to have we have an interim information that we'll be placing, but then we'll tweak the dashboard and change it appropriately so we can reflect a lot of the indicators that I've spoken to you about before that we're speaking to. So right now we're at 3,402 active cases in our region. Overall, the cases are going down. Yesterday we reported 73, and I'll show you kind of trends. Although we're not capturing all the cases because we're not testing non-high risk situations, the trends are helpful in terms of 7, 14-day rates. Hospitalizations are at 35 right now, and that's total for COVID. There might be more with COVID positive, but these are the ones that are in for COVID. It's hard for us to get that information from the hospitals, but we do it manually. For example, now we have patients in 6 hospitals from our region, including 8 in ICU. The majority of them this time around are actually vaccinated. But cumulatively, again, if you look at the beginning, the trends are, and I'll show you later, that the majority of individuals, particularly in ICU, have been and are non-vaccinated individuals. And the individuals that tend to end up in hospital are the older age group in the 70, 80, 90 age range. We've had 140 deaths in our area. 2 were added. Again, these were related, these were community related in elderly individuals. I don't have the vaccination status, but we'll be putting all that information on our website in a cumulative way. Right now, we have 41 outbreaks in congregate care settings, 12 in Cornwall, 12 in SDNG, 15 in Prescott Russell, and 2 in Akwesasne. And our test positivity right now is 22.2%. That is, again, that's going downwards. And I have a slide that's going to show. So it's important that when we have these numbers, we look at the trends, we look at the trajectory of these to give us an indication of where we are with that. In addition to that, absenteeism at schools, absenteeism at work in general will also give us another idea of trends of where we are. And then finally, we're going to look at wastewater trends. And this is a graph that we have now, which is up until January 12th. And so we still need some more, but you can see that in Cornwall and in Hawkesbury, where we do the measurements, the water spiked up both in Cornwall and both in Hawkesbury. And again, we just look at that as trends. We don't look at it as absolute numbers. We just look at it as trends, and you could see the trend corresponds with the number of cases that we had. So I'm anxious to see what we'll have in the next week or so. Hopefully, we'll get a downward trend on that. Again, that is a measure that is independent of testing. It's just the wastewater COVID levels that we're following. In Canada, again, this applies to us locally. By far, most of the cases are now Omicron. Omicron has taken over. The red line on the graph shows you that. And so we are presuming all cases now that are positive in our area and in Ontario for that matter, and in Canada for that matter, are highly likely to be Omicron. In terms of the overall trajectories, we are, again, the case rates that I told you about, again, albeit they are sort of looking at numbers now that are reflecting only testing high-risk individuals, but they still give us trends if you continue to follow them. What we're seeing here is that, again, the numbers in Ontario are going down and in health units are going down. Some are going up. You can see specifically the ones that are going up on the left hand side here, the blue, but you could see a majority are now going on a downward trend, and that includes us. Last week we were number 1 here, and so we're now enjoying a downward trend in the numbers. Again, it's trends.
I'm sorry to interrupt you, Dr. Paul.
Yes?
We're still seeing your first slide.
Yeah, you see, that's why I wanted to I will ask you, I'm going to have to show it in the other mode. Okay, so very quickly, I'm just going to go back. Just wanted to show you. So here, do you see this wastewater here?
We see your second slide, yes.
Okay, so I'll have to keep it in this mode. It doesn't show for some reason in presentation mode. So again, just quickly, this is to show you the wastewater levels, which have peaked in late December, early January in both Hawkesbury and Cornwall. The next slide. All right. The next slide just shows you the Omicron that I talked to you about. Again, this is the 14-day rates that are going downwards in a majority of health units right now, including ours. And this next slide here just shows you the comparison between last week and this week. Last week, our rates were 823. This week, we're in the 569 range. And so you could see, you could compare provincially as well. The numbers are trending downwards. In terms of test positivity, I had told you that we were at overall 22%, and we break it down by FSA, by different areas. For example, this is Hawkesbury up here, and the rest are outlying Cornwall. And you can see that last week Hawkesbury was 41%, now it's 27%. Last week, this is a Platte Déjeuner area, was 36.9, now it's 26.6, and so on. You can see that the trends are downward, so that's a good sign in terms of the positivity. And you could see again health units with increases, but we are on the downswing here. You can see that our positivity is going down. Again, these are all indicators moving forward. And you could see as well, provincially, overall, there is a downward trend, but some are pulling it upwards, like Peel, Durham, and Lambton. But again, as I said, our situation is lower. Again, this is Canadian data. So again, it just reflects the fact that the positivity has gone up, but it's slightly starting to go down again. And yes, very high laboratory test positivity indicates widespread disease. And this is nationally. And so this is just confirms what we're seeing at the local level. And now I just want to go over a bit of a vaccination. So right now we're at over 426,000 doses administered in our region. We're at 87.1% first dose, the 5+ population, and almost 81% second dose. We've administered over 81,000 third doses right now, and it's almost 47% of our population. And that breaks down in the next slide, where we see the percentages. And again, the dark green is third dose. And you could see that we're almost at 80% in the 80+. We are at 76% in the 70 to 79. We're at 64% in 60 to 69, 44% 50 to 59, and then lower in the other younger age groups, almost 34%, 40 to 49, 28.7%, 30 to 39, and 21% in 18 to 29. So these are the age groups that are receiving a third dose. You can see that we're at 47% school age kids with 700. That means that equals 7,827. So we got about 15,000. We got another almost 8,000 to go. So we're anxious to start working. We are starting to work with our school, have opened up our clinics to 5 to 11-year-olds that can walk in. So we really want to get this number up, particularly as kids go back to school. Some of the other data that I want to show you is cumulative rates, and this is Ontario data as of January 17th, and we're looking at case rates. So it's very hard to compare vaccinated versus non-vaccinated without looking at the case rates. In other words, rate of a certain, be it a case, be it a hospitalization, be it an ICU admission, you need to look at it over the population level. So numbers, rates. So we know that the COVID case rate right now among the unvaccinated is 99 per 100,000. It's 52. It's almost double that of vaccinated individuals. And that is, it used to be lower than that in vaccinated individuals, but that's because Omicron has a breakthrough at a high rate with 2 doses. And that's why we're trying to give a third dose. But you can see there's a reduction in the risk, and that reduction of risk becomes even higher as you go into hospitalization. And again, this is Ontario data. I want to stress 102 per 100,000 rate of unvaccinated versus 20 vaccinated, and that's fivefold. So that's an 80% risk reduction. And ICU admissions is even higher protection. So the rate is almost 13 times higher for unvaccinated versus vaccinated to get into our ICUs. And so that is significant. And you can also see it at a national level. This was till December. The data that I have here is to January, but you could see that by far the unvaccinated made up the majority of hospitalizations, and there's now almost, like I said, 19-fold increase among unvaccinated people to be hospitalized in terms of likelihood versus versus vaccinated individuals. And so the gap here is a bit lower because we're starting to get breakthrough infections among the vaccinated. Because of the fact that the Omicron does not prevent the illness. Sorry, this is different. The gap is still there, but what I wanted to say is that the case rates are significantly closer in terms of the rates, but you could still see very high protection among that. In terms of moving forward, again, some of the things that we're doing right now is our vaccination rates. Third dose vaccinations are moving very well. I think what my aim right now, my first aim is to have as high rate as possible for those elderly 50 and over. We have opened our clinics to 50 plus as well as a priority. They can walk in from our area as well as the 5 to 11-year-olds. We are working with our schools right now to continue school-based vaccinations, teachers, and so on. We have clinics 7 days a week right now. And we keep adding clinics to the system. So please go online and get your vaccinations. Pharmacies as well are available throughout our region for first, second, or third dose. Again, if you haven't been vaccinated, please get your first dose. If you need your second dose, please go get it. And if you need your third dose, please don't hesitate to go and get it. Again, collectively, that is the best strategy for us to move forward, to be able to start seeing sort of the end of this fifth wave, which I believe is about to sort of plateau. Looking at the provincial numbers, the hospitalizations have plateaued, and you can see some of the rates have plateaued. So hopefully we'll be seeing a downward trend. But again, it's going to be hard for us to predict when we're at the downward trend. Probably by the end of the week, we'll have a better idea looking at the numbers. So that'll give us a better idea of the projection and trajectory. Our priorities, aside from vaccination, obviously, are high risk outbreak management, hospital workers, long-term care residents, and so on, working and supporting those institutions as they go through outbreaks, as they go through staff shortages, and so on. Again, we will be creating a set of new indicators, following a set of new indicators, like a new type of scorecard, looking at the trends, importantly the trends, which will give us an idea of levels, and then that at the provincial level will inform and guide when to remove restrictions. And obviously school reopening, we're working with our schools just to ensure that IPAC is in there answering the questions and so on. We're not doing any outbreak management or case management, but we're supporting our schools, which, as you know, opened 2 days ago. Actually yesterday because of the snow day, but we're working with our partners already. We're meeting with our directors regularly. Our school teams are meeting with our schools on a regular basis. And then the indicators, again, will link into the timing of removal of the current restrictions and closures. As you know, the current restrictions are due to, are up till January 26th, but there's no guarantee. It'll all depend on the trajectory of where we are. And again, we're actually going to be going into that pandemic to endemic shift that I was telling you about. We're actually witnessing it. You know, it's progressive as we move forward. I'm just going to take some questions, but I just want to say something in English. I forgot. One of the things that I think is a game changer is the approval of the new antiviral medication. Certainly, this is something we were waiting for. This is an antiviral medication that, when given early on in the first 5 days, can diminish the need for hospitalization or severity, decrease the severity up to 89, 90%, depending on when you take it. And so I think that is a game changer. That is also going to be something that will protect our healthcare system and will allow us to be that endemic state, kind of live with it. combined with vaccinations, public health precautions, and the antivirals, we'll be able to better protect the vulnerable individuals and better protect our healthcare system. Now, I want to underscore that this does not replace vaccination. We need to get vaccinated, but this is an additional supplementary tool, particularly in elderly and immunocompromised individuals where vaccine doesn't work very well for multiple reasons, that these medications to me are a game changer. And I'm very happy that Health Canada approved them this past week. So Jen, I'm ready for questions.
Thank you, Dr. Paul. Merci. Première question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul. Je me suis fait poser cette question-là plusieurs fois au cours des dernières semaines. Quelle est la directive à l'égard des gens qui s'apprêtaient à recevoir leur dose de rappel, leur 3e dose, mais qui ont attrapé la COVID au cours des dernières semaines? Doivent-ils maintenir leur rendez-vous ou bien on leur suggère de repousser la 3e dose?
Très bonne question, Denis. En effet, actuellement, la guidance, que aussitôt que vos symptômes et votre période d'isolation est terminée, vous pouvez être vacciné. Donc, il ne faut pas attendre. Avant, on avait un protocole qui disait qu'il faut attendre au moins 30 jours, mais non, on a changé. Les personnes qui ont subi du COVID confirmé peuvent recevoir soit le 2e ou 3e dose, ou même première dose, aussitôt qu'ils finissent leur période d'isolation et que les symptômes sont tous disparus.
Merci beaucoup.
Pas de problème.
Prochaine question, Benjamin Vachet, Radio-Canada. C'est à vous.
Merci beaucoup. Bonjour, Dr. Paul. Je voudrais faire du pouce sur la question de mon collègue Denis Babin, parce que là, vous dites effectivement, c'est pour des personnes qui savent qu'ils ont eu la COVID, mais on sait qu'en ce moment, il est très difficile de se faire tester. Beaucoup de gens ne savent pas s'ils ont eu la COVID. Alors, qu'est-ce qu'ils doivent faire si, par exemple, ils pensent peut-être l'avoir eu ou même ils sont asymptomatiques? Est-ce qu'il y a un risque à recevoir une dose si on a eu la COVID?
Premièrement, on a une pénurie de médicaments. On n'a pas beaucoup de médicaments disponibles. Je pense que le Canada a reçu 30 000 doses. Donc, pour le moment, on va avoir des protocoles qui vont vraiment limiter l'accès aux personnes 80. Je pense qu'on a des indicateurs, ne sont pas officiels, mais je pense que 81 et plus, les personnes avec immunodéficience ou transplantation, greffe, etc., qui, aussitôt qu'on les diagnose, et ça, c'est les personnes qu'on teste actuellement, mais il va y avoir des protocoles et des protocoles en place pour qu'on puisse, les personnes en risque, pour être testées, même testées avec les tests rapides PCR. On est en train d'en discuter actuellement pour que les gens pourront aller dans un centre de dépistage, si vous voulez. Ils vont les tester et ils vont avoir les résultats tout de suite. Et à ce moment-là, on pourrait le prescrire. Au pire aller, si on fait le PCR, on aurait les résultats un jour après. Ils vont avoir la prescription à main, ils vont le prendre. C'est pour ça qu'on va le restricter comme ça. Mais disons que si on a beaucoup de médicaments et si on soupçonne qu'on pourrait avoir, et si on est dans une personne de haut risque, je pense qu'on pourrait le prendre sans le test. Je pense que dans les régions éloignées, etc., on n'aura pas de choix. Mais pour le moment, étant donné qu'on n'a pas assez de médicaments disponibles en Canada, on va restricter l'utilisation chez les personnes qui sont en haut risque et déjà sont les personnes qui ont accès à se faire tester.
Et Dr. Paul, une deuxième question sur la levée des restrictions. Vous avez parlé du 26 janvier. Est-ce que c'est réaliste et est-ce que vous pensez qu'on devrait ou qu'on pourrait voir les restrictions levées prochainement?
Je pense que le 26, c'est un peu trop tôt, peut-être une semaine après, je ne suis pas sûr encore. Je sais que le gouvernement est en train d'en discuter. Moi, je ne vois pas une ouverture avant le fin janvier, à mon avis, parce que ça va nous donner le temps de vraiment voir d'ici. Je pense qu'on a besoin d'un autre 5-6 jours de voir où on va être dans quelques jours. Si on voit que le trajet est en diminuant, je pense que la décision va être prise. Mais c'est une chose qui est difficile à vous dire aujourd'hui, mais je vois, comme j'ai démontré sur le diapo, je vois une diminution, une tendance d'avoir une diminution. Donc, ça, c'est une décision du gouvernement. Et on va voir, dépendamment de ce qu'ils vont faire comme décision, mais à mon avis, ça ne devrait pas aller avant le fin janvier.
Merci beaucoup.
Next question, Giacomo Panico, CBC. Please go ahead.
Yes, hello, Dr. Meliodas. Thank you very much. A question about schools and vaccines. You mentioned that there's a gap there. You're looking, if I had that right, only 47% of children at this time have their second dose. First dose, only 47. Okay. Yeah. And is it a case that you're looking to administer the vaccines in the schools? Did I get that correct?
Well, there is a possibility, but I don't think that we'll be very successful in doing that, Giacomo, because I don't think a 5-year-old a parent would want their 5-year-old to be vaccinated without them there. So that will be one of the choices, but I don't think there will be a lot of uptake. We are providing vaccines in the school settings on weekends and evenings where the parents can come with the children, and we're also providing access to all of our clinics 7 days a week without an appointment to the 5 and 11-year-olds. So we're doing as much as we can to make it easy for parents to come. We're working with the schools to again look at opportunities or look at areas where they're under vaccinated. But yes, there is we were asked to look at the possibility of doing it in the schools. Like I said, perhaps an 11-year-old, the parents would agree to, but I don't think for a 5 or 6-year-old. So we need to have a multitude of approaches.
And sorry to step back then, just with that 40% number of first dose, I mean, what do you make of that? It seems low to me, but what do you think?
Yeah, it is low. I was hoping we get over 50% by the end of December, and because that's how we saw what happened with the 12 to 17-year-olds, and then it picked up. This is a provincial. This is not only us. This is sort of a provincial trend that we're seeing. There are a lot of questions. There are some surveys that we have conducted nationally, and parents want to wait. Just like the 12 to 17-year-old parents waited, and we saw an uptake a bit later on as people got more confident. We got that. Parents also think that the disease is very mild in children and don't need vaccinated. So there are a few factors. It doesn't have to do with access. It has to do with parental hesitation. I understand that. I'm a pediatrician. And so what we're trying to do is trying to convince the parents, and the more time that goes by, the fact that we have not seen any significant side effects, including pericarditis or myocarditis in this age group, I think is very encouraging. So I think a lot of parents are waiting, and so there's going to be a bigger public relations campaign, a media campaign over the next couple of weeks, both locally and provincially, to be able to provide more information to render the parents more confident for the vaccine. So it's not an access issue. It's a question of parents still holding back because they want to get a bit more information and just want to see some of the longer term effects.
Thank you very much.
No problem.
If anyone else has questions, please unmute yourself now. If you're joining by phone, press *6. S'il y a d'autres questions, vous êtes invité à ouvrir votre microphone. Si vous vous êtes joint par téléphone, appuyez les touches *6. Those are all the questions for today, Dr. Paul.
Thank you. Merci tout le monde.